Welcome back to Mindful Objective. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Before we get into today's episode, I want to remind you this podcast is for educational purposes only. We do not treat, diagnose, or cure any illness or disease. So today we're going to talk about one of the biggest topics right now in weight loss and metabolic health. That is Retatrutide, and it's attracting attention for its effects on weight loss, blood sugar, appetite, liver fat, and clinical research. Retatrutide is not just an GLP-1 medication, that is for sure. So let's go ahead and jump right into it. This podcast may be a little long because there's a lot to go over, but it's a hot topic we need to talk about. Retatrutide is an investigational medication being studied for obesity, type 2 diabetes, and metabolic health. The reason it's getting so much attention is that it targets 3 hormone pathways rather than just one. It targets GLP-1, GIP, and glucagon receptors, and these all play a different role in appetite, in the insulin response, blood sugar balance, and energy production. GLP-1 helps slow down digestion, it'll improve fullness, and supports insulin release when the blood sugar rises. GIP also plays a role in insulin regulation and may work with GLP-1 to improve metabolic effects. Glucagon receptor component makes retatrutide especially interesting, as glucagon can influence your energy use and fat metabolism in ways that may contribute to weight loss. So to understand why it matters, it helps to compare retatrutide to other medications people already know. Semaglutide is used in other medications like Ozempic, and it's a GLP-1 receptor agonist. Tirzepatide, used in Mounjaro, this activates both GIP and GLP-1 receptors, so it's 2 in 1 versus Ozempic, that was in 1, semaglutide. Retatrutide goes a step further by adding glucagon receptor activity, which is why it's sometimes described as the triple agonist. In a phase 2 obesity trial published in the New England Journal of Medicine, adults with obesity or overweight achieved substantial weight loss over 48 weeks. In higher dose groups, average weight loss reached levels that will caught the attention of the researchers and clinicians. This is important because obesity is not just about appearance or willpower. Obesity is connected to metabolic syndrome, insulin resistance, type 2 diabetes, fatty liver disease, sleep apnea, inflammation, cardiovascular risks, and even hormonal changes. When medications cause significant changes in the body, they may also reflect on related health concerns. So this is part of why the medical community has to pay close attention to this drug class. Research on semaglutide, tirzepatide has already shown an increased base therapy that can produce meaningful weight loss in those clinical trials. It was seen in real practice. Retatrutide is now being studied as a possible next step in that same conversation. With that said, retatrutide is still being studied, and that matters. People online often talk about the newer weight loss medication as if everything's already settled, right? But long-term data still takes time. Phase 2 trials are important, but they are not the same as long-term real-world use across the different types of patients. We need to understand effectiveness, safety, tolerability, long-term maintenance, and what happens when you stop taking it. We also need to understand how these medications affect lean mass, your nutrient intake, quality of life, and long-term metabolic resilience. That is why this episode is not just about weight loss numbers. It's about those numbers, what they mean inside the body. So again, retatrutide is popular because it sits at the center of several major health conversations happening right now. You see this all over social media, Reta. People are searching for it to help with weight loss, insulin resistance, food noise, cravings, blood sugar problems, and metabolic syndrome, even for longevity. GLP-1 medications have changed the way weight loss conversations are happening by addressing the appetite and metabolic signaling in ways many people have not experienced before. For someone who has battled hunger, cravings, repeated weight gain, that can be very different from traditional dieting. So research on semaglutide showed a meaningful weight loss in adults with overweight or obesity when paired with lifestyle intervention. Still have to change your lifestyle even though you're taking these injections. Tirzepatide research also shows substantial and sustained body weight reduction in adults with obesity. But again, you got to change your diet. The phrase food noise, this has become common because many people finally have language for something that they have experienced for years. Food noise is the constant mental pull towards that food, towards snacking, cravings, and thinking about the next meal even when your body doesn't need that fuel, right? You don't need the food in your system. You already have it, and your body's still giving you those cravings. So these medications can reduce appetite signals for many people, which may help them make better food choices and overall reduce overeating. So that does not mean the medication fixes every behavior or emotional part of eating. It means it may reduce one powerful driver that makes weight management difficult. When appetite is calmer, people may find it easier to build healthier patterns. Another reason Retatrutide is drawing so much attention is the magnitude of the weight loss seen in research. Retatrutide, again, going back to that New England Journal of Medicine phase 2 obesity trial, Reta produced dose-related weight loss, with higher doses showing larger average reduction. Now, in a separate phase 2 trial in people with type 2 diabetes, which was published in The Lancet, Retatrutide reduced HbA1c and body weight compared to placebo. That's very important. That is because weight and blood sugar are often connected through insulin resistance and that metabolic dysfunction. When a medication affects both body weight and glycemic control, it becomes highly relevant to discuss about that metabolic disease. This is especially true for people with obesity, prediabetes, or type 2 diabetes. So there is also growing interest in how these medications affect the liver. Metabolically, dysfunction associated with steatotic liver disease, often discussed as fatty liver disease, is strongly connected to insulin resistance and obesity. A Nature Medicine study reported that Retatrutide reduced liver fat in patients with metabolic dysfunction associated with that fatty liver disease in that phase 2 substudy. That is important because fatty liver can be silent for years while affecting metabolic health. Many people do not know they have fatty liver until imaging or labs raise concerns. They find it by accident. That is one reason why integrative care should not only focus on scale weight, right? We also got to focus on liver enzymes, your insulin, glucose, your triglycerides, your inflammation, and your body composition. The problem is that popularity can move faster than education. People hear about a new medication and immediately want to access it without understanding that bigger picture. They may not know what labs to monitor, what side effects to watch out for, or how to protect muscle when you're losing weight. We see that a lot. A lot of people are losing weight on semaglutide and other GLP-1s, but they're losing muscle mass, not just fat. They may not also understand that medication can reduce appetite without automatically improving nutrition quality. So eating less junk food is helpful, but eating too little protein or fiber or minerals or micronutrients can create new problems. This is where mindful objective approach matters because the conversation should include the medication, and it shouldn't just stop there, right? You got to focus more on your health overall and your nutrition. So before taking and talking about any medication, we need to talk about why weight gain happens in the first place. Most people still think weight gain is only about willpower, but that view is incomplete. Calories matter, but hormones, sleep, stress, inflammation, blood sugar, medications, activity level, gut health, and food quality all influence how the body stores and uses energy. When those systems are disrupted, the body may become more likely to store fat and less likely to burn it efficiently. So that does not remove personal responsibility, but it does explain why weight loss can feel so much harder for some people than others. The body is not a simple calculator. It's a living system that responds to signals. So insulin resistance is one of the biggest issues behind weight gain and metabolic dysfunction. Insulin helps move glucose out of the bloodstream and into cells. When those cells become resistant, the body can't produce more insulin to do that same job. Higher insulin levels can make fat loss more difficult because insulin is a storage hormone. A person can have normal fasting glucose for years while insulin is already elevated, which is why fasting insulin can be helpful from a functional health perspective. Standard labs often include glucose and hemoglobin A1c, but fasting insulin is frequently skipped. That means people may be told everything looks fine even when early metabolic dysfunction is developing. So stress is another one we always talk about, and that's a major driver that gets ignored. Chronic stress can increase cortisol, it can disrupt your sleep, increase cravings, and make blood sugar less stable. When the body feels it's under constant pressure, it tends to prioritize survival rather than fat loss. Many people respond to stress by sleeping less, moving less, eating more processed foods, and, the common one, relying on caffeine. Over time, that pattern can contribute to weight gain and metabolic strain. That is why weight loss plan that ignore stress often fails in the long run. You cannot out-supplement or out-medicate a lifestyle that keeps pushing the nervous system into overload. It just can't be done. Sleep is just as important. Poor sleep affects hunger hormones, your appetite, same, insulin sensitivity, decision-making, your recovery. When someone sleeps poorly, they often wake up hungrier, crave more carbohydrates, and have less energy to exercise. Research around obesity and metabolic health continues to point sleep as a major part of that picture. Even the best medication plan can be limited if someone is chronically sleep deprived. That is why we always say mindful. It's not just a prescription or a supplement list, right? There's more to it. You need a full system approach. A plan that supports sleep may improve results from every other intervention. So inflammation and gut health also need attention. Chronic low-grade inflammation can interfere with insulin signaling and your energy production. Gut dysfunction may influence your appetite, your digestion, nutrient absorption, bloating, cravings, immune activity. Many people with weight issues also deal with digestive symptoms, right? Food sensitivities, constipation, acid reflux, bloating. These symptoms may not directly cause obesity, but they can make it harder to feel well and stay consistent in what you're doing. From an integrative health perspective, weight loss is not just about eating less. It's about improving that internal environment so the body can function better. Now back to Retatrutide obesity trial, again, published in New England Journal of Medicine. This is one of the main studies that are driving interest. This is the phase 2, multi-center, randomized, double-blind, placebo-controlled trial that was on adults with obesity or that were overweight. Participants received different dosages of Reta or a placebo, right? You got one or the other. And the study evaluated weight loss over time. The higher dose groups had substantially average body weight reductions in 48 weeks. The study also reported gastrointestinal side effects, which is common in medication class. These details matter because the benefit and side effects need to be discussed together. The Lancet Phase 2 study looked at Reta in people with type 2 diabetes. In that study, Reta reduced HbA1c and the body weight compared to placebo. This is important because people with type 2 diabetes often have more complex metabolic challenges than those without diabetes. So improving blood sugar while reducing body weight can be valuable, but it also requires careful monitoring. People taking diabetes medication may be at risk for blood sugar changes when appetite, food intake, and body weight shift. That is why a healthcare provider should always supervise these medication changes. We can also learn from research on semaglutide, tirzepatide as they are part of that broader conversation. In Step 1 trial, semaglutide 2.4 milligrams produced significant weight loss in adults with overweight or obesity when used with lifestyle intervention. In the Surmount-1 trial, tirzepatide produced substantial and sustained weight reductions in adults with obesity or overweight without diabetes. These studies help change how clinicians think about obesity treatment because they show that targeting appetite metabolic signaling can produce large effects. Retatrutide is being watched closely because it's a triple mechanism which may push this area even further. Right? Another area to watch is body composition. Weight loss is not automatically the same as fat loss. A person can lose scale weight while losing lean muscle mass, which creates problem later. 2025 Lancet Diabetes and Endocrinology analysts report that Retatrutide improved total body fat mass reduction in adults with type 2 diabetes, and the portion of lean mass loss to total weight loss was similar to the obesity treatments. So that finding is helpful, but it does not remove the need to protect muscle through protein intake and resistance training. Even if the portion is similar to other treatments, large total weight loss can still include meaningful loss of muscle mass. That's very important because muscle mass is critical to your aging. So the research is promising, but it should be read with care. Clinical trials are in a controlled setting, which is specific inclusion and exclusion criteria. Real-world patients may have different health histories, medical combinations, medication combinations, nutrient deficiencies, hormone issues, sleep problems, and stress levels. Those are all things that need to be taken into account. So that means results can vary. It also means that people need a plan that includes monitoring and support. So that is where functional integrative approach can add value to looking at that whole person. The medication may be one tool, but the person still needs nutrition, movement, labs, and long-term strategy. So the first concern now we got to understand the side effects that are out there. I would say the first concern right here is gastrointestinal side effects. This is one of the biggest ones reported. So in clinical research that activate GLP-1 pathways commonly cause nausea, vomiting, diarrhea, constipation, bloating, and even reduced appetite. Retatrutide studies also reported gastrointestinal adverse events, which fits in what's seen when that whole medication class. For some people, these side effects are mild and improve over time. For others, they can be destructive and make it more difficult to eat enough protein, fluids, fiber, and nutrients. That is why dose escalation, hydration, meal size, and food choices matter. The second concern, like the other ones, is muscle loss. When people lose weight quickly, the body can lose both fat mass and lean muscle mass. Muscle is not just for appearance. It supports glucose disposal, your metabolic rate, strength, balance, mobility, and healthy aging. Losing too much muscle can make it long-term maintenance harder because muscle helps the body use energy more effectively. That's why every weight loss plan involving medication like this should include protein goals and resistance training. The scale should not be the only measurement. Body composition matters here. The third concern is undereating. When appetite drops, some people eat very little and assume that's a good thing because the scale moves quickly. The problem is that very low intake can reduce protein, fiber, electrolytes, vitamins, minerals, essential fatty acids. Over time, that may contribute to fatigue, constipation, hair shedding, losing a lot of hair, dizziness, weakness, poor recovery, and mood changes. Eating less is not automatically eating better. A structured nutritional plan is still needed, even if that hunger is lower. Many cases, people need to be more intentional with their food, while appetite-reducing medications are less intentional. So another one that you don't hear a lot too is the fourth concern here is the gallbladder stress. Rapid weight loss itself can increase gallstones risk and digestive changes that may contribute to symptoms in some people. Another is the right upper abdomen pain, nausea after fatty meals, fever, yellowish of the skin, and severe abdominal pain. These all need medical evaluations. So take them seriously. People often focus only on the weight loss and ignore the digestive warning signs. This is not wise. The body still needs to be monitored during metabolic changes, right? You're making big changes here. The fifth concern is long-term plan. What happens if the medication is stopped? Some people regain weight after stopping obesity medications if those underlying habits and metabolic drivers are not addressed. This is not moral failure. It reflects the fact that obesity is often a chronic metabolic condition with biological drivers. Long-term maintenance requires nutrition, sleep, workouts. You need more muscle, stress control, blood sugar stability, and that ongoing monitoring. Continue running labs, continue working with your practitioner. So medications may be part of the plan, but it should not be the entire plan. This is exactly where Mindful Objective can help people build that lifestyle and labs based on structure and that medication conversation. So now let's talk about conventional labs. These are important starting points for anyone considering or using medication that affects weight, appetite, or blood sugar. A comprehensive metabolic panel, CMP, this can help assess kidney function, your liver enzymes, electrolytes, your glucose. Liver enzymes such as ALT and AST matter because metabolic dysfunction and fatty liver often travel together. Kidney markers like creatinine or estimated filtration rate, EFR, matter because hydration, medication use, and metabolic changes can affect that bigger picture. Electrolytes matter because reduced intake, vomiting, diarrhea, or low hydration can create imbalances. We see this one a lot. And these are basic labs, but they are not optional for some people making these metabolic changes. So hemoglobin A1C and fasting glucose are also key conventional markers. A1C gives you an estimate of average blood sugar over roughly the past 3 months, while fasting glucose gives you a snapshot and a glucose at that specific point in time. These markers are useful, but they do not always catch early insulin resistance. Someone can have normal glucose in the A1C while fasting insulin is already elevated. That is why many integrated practitioners like to include fasting insulin as well. The earlier insulin resistance is identified, the better chance of intervening before diabetes develop, right? You don't want to do things after the fact. And remember, when is your health important to you? You need to be proactive rather than reactive. So a standard lipid panel is also important. This includes total cholesterol, LDL cholesterol, HDL cholesterol, triglycerides. Triglycerides and HDL can give you clues about insulin resistance and metabolic health. High triglycerides often occur when carbohydrate handling and liver fat metabolism are suboptimal. You could get high triglycerides. One thing is, juicing a lot. It causes a lot of people to raise their triglycerides. You're getting a lot of sugars there from normal fruits and vegetables. So keep that in mind. I experienced that personally, testing things out. So LDL cholesterol still matters, but it's not the only cardiovascular marker to consider. Weight loss can change lipid numbers, sometimes improving them and sometimes shifting them in ways needs a better review. Monitoring helps people understand what's actually happening rather than assuming everything is improving. Always don't guess, test. So CBC, complete blood count, is another useful test. It gives information about red blood cells, white blood cells, hemoglobin, hematocrit, your platelets. While it may not seem directly connected to weight loss, it can reveal anemia, infection patterns, immune activity, and other issues that may affect your energy and your safety. If someone is eating less and feeling fatigued, a complete blood count may provide clues. It can also help identify whether symptoms are related to nutrition, to inflammation, or something else that needs a medical review. Good care does not rely on one marker. It looks at patterns. For those using or considering GLP-related medication, pancreatic and gallbladder symptoms should be taken seriously. Routine pancreatic enzyme testing, this is not always done for every person, but if symptoms are severe, such as a bad abdominal pain, you get a lot of vomiting or pain radiating in the back, these all require medical attention. Same with gallbladder. You need evaluation. This may be needed if symptoms like gallstones or gallbladder inflammation arises. This is why the podcast needs to keep reminding listeners that medications require supervision. The goal is not fear. The goal is educated awareness. So now let's talk on the integrative health side about functional labs and taking that deeper marker look. So functional lab testing goes beyond basic disease screening that assess how well the body's functioning, like a conventional blood work. We still focus on running those, but we also want to incorporate functional labs. That is where Mindful Objective can bring real value because many people have been told their labs are normal while still feeling exhausted, inflamed, hungry, foggy, just stuck at where they're at. Functional testing can help identify patterns with blood sugar, with inflammation, with hormones, nutrient status, your gut health, and those important detox pathways. It does not replace conventional medicine, but it can add depth to that whole conversation. When used correctly, it creates a more personalized plan. This is especially helpful for people using medications that change their appetite or body weight. Fasting insulin is one of the most important markers to consider. It can show early signs of insulin resistance before glucose or A1C becomes abnormal. When fasting insulin is elevated, the body often works harder than it should to manage blood sugar. That can make weight loss more difficult and increase that metabolic risk over time. Tracking fasting insulin levels before and during weight loss plan can help show whether the body is becoming more insulin sensitive. For many people, this marker is more revealing than glucose alone. High sensitivity C-reactive protein, also known as HSCRP or CRP. It's another useful marker for us. It gives us insight into systematic inflammation, which is connected to cardiovascular risk and at metabolic dysfunction. Inflammation can come from many sources, including poor diet, poor quality of your food, obesity, stress, poor sleep, infections, gut issues, and those environmental exposures. If your CRP is elevated, the plan should not only focus on weight loss, but it should also include reducing inflammatory load. This may include omega-3 intake or increasing omega-3 intake, improved sleep, movement, gut support, and better quality food. A lower scale number is helpful, but lower inflammation is also a major goal. Advanced lipid testing can also provide deeper cardiovascular insight. ApoB, this is another marker that reflects, and this one's more popular. It reflects the different particle sizes that contribute to that plaque risk. Some people have LDL cholesterol, and that does not tell the whole story, which is why ApoB is very helpful. So LDL particle size testing may also provide information on particle number and size depending on which lab is used. This is especially important for people with metabolic syndrome, insulin resistance, family history, or abnormal triglycerides. Weight loss medications may improve some metabolic markers, but cardiovascular monitoring still matters. Hormones should also be part of that conversation, especially for men and women dealing with fatigue, weight gain, low libido, mood shifts, poor recovery. For men, total testosterone, free testosterone, SHBG, estradiol, DHEA, and morning cortisol can provide meaningful insights. For women, hormone testing may depend on age, cycle status, menopause status, symptoms, and medication use. Thyroid markers are also important because this is good for both men and women, and these include TSH, free T4, free T3, thyroid antibodies, and sometimes reverse T3 depending on the case. If the thyroid function is struggling, energy and weight regulation may be affected. Functional labs help connect these dots instead of treating weight as a single issue. Oftentimes, there's a lot more going on than just you're gaining weight. There's a reason behind it. What is that root cause? So the mindful objective approach is built around the idea that weight loss should not be separated from the whole body health. Retatrutide may be a powerful medication, but it does not replace the need for nutrition, movement, sleep, stress support, lab testing, supplement planning. Many people lose weight but never learn why they gained it in the first place. Others lose weight but feel weak, tired, constipated, and nutritionally depleted because they have no support plan. That's where integrative care can make a real difference here. The goal is to help the body function better, not just make the scale drop. Mindful Objective can also help people think through lab testing and help work through that in a more complete way. This may include conventional markers like glucose, A1C, lipid panel, liver enzymes, kidney markers, that CBC, complete blood count. It may also include functional lab markers like fasting insulin, that HSCRP, ApoB, ApoA, thyroid markers, cortisol, sex hormones, vitamin D, B vitamins, ferritin, magnesium status, and gut-related testing when appropriate, such as that organic acid test. Testing helps reduce guessing and allows people to build a plan around their actual physiology. Someone with insulin resistance needs a different strategy than someone with low thyroid function or low testosterone. That's where personalization matters. Nutrition support is another key piece. People taking appetite-reducing medications may need help eating enough protein, balancing those meals, and avoiding those nutritional gaps. The goal is not to force large meals when appetite is low. The goal is to make every meal count. That may mean protein-first meals, easy-to-digest foods, fiber support, hydration, electrolyte awareness. It may also mean using protein powders or targeted meal planning when whole food intake is too low. Mindful Objective can help people think through these choices from a practical standpoint. Supplement guidance also matters. Supplements should not be random or used as replacement of medical care. They should be matched to the person's labs, to your symptoms, to your goals. Magnesium may support sleep, glucose metabolism, muscle function. Omega-3 fatty acids may support inflammation balance, cardiovascular health. Vitamin D may work for immune, hormone, and metabolic health when those levels are low. Fiber, electrolytes, digestive support, and protein supplementation may also be useful depending on the person. The key is building a plan that fits the person, not copying a generic online routine. Everybody shares everything and says, try this, do this, but it's not specific to you as an individual. Again, what works for one does not always work for another. It rarely does. So remember, Mindful Objective offers access to healthcare products and supplements, including the option for that 20% off retail. This can be helpful when people choose better quality support of high quality products, high quality third-party tested products. The goal is not to take more supplements. The goal is to take the right support in the right form and for the right reason. When supplements are paired with labs and a health plan, they become tools instead of guessing. That is the difference between a cabinet full of bottles and a strategy that actually makes sense. So if there's one part of this conversation that needs more attention, it's muscle preservation. Muscle is one of the most important metabolic organs in the body. It helps clear glucose out of the bloodstream, supports insulin sensitivity and improves strength, protects mobility, and helps maintain that metabolic rate. When people lose weight too quickly without protein and strength training, they may lose more lean mass than they realize. They get on a scale, they drop a lot of weight, but it's not fat loss. It may be muscle loss. And then what happens if they fall down, get hurt? A lot of things can happen. So it can make them lighter, but not necessarily healthier. The goal should be fat loss with muscle preservation, not just weight loss. Protein intake should be a majority and that major part of anyone losing weight. That's something they should focus on. When the appetite is low, protein can be the first thing that people undereat on because it's more filling and sometimes harder to tolerate. That means people need to be intentional. Protein goals should be individualized based on the body size, your kidney health, your activity level, your age, your medical status. Many people benefit from building meals around protein first, then adding fiber-rich carbohydrates, healthy fats, and colorful plant foods. If eating enough whole protein is difficult, protein shakes may help fill that gap. As soon as you wake up, have 30 grams of protein. How can I do that? Easily with a protein shake. Strength training is just as important. Walking is great for health, but it does not replace resistance training. The body needs a reason to keep muscle during weight loss, and strength training provides that signal. That does not mean everyone needs to lift heavy or train like an athlete. It can start with body weight movements, right? You can start with bands, machines, dumbbells, even supervised coaching would be good to have. The key is consistency and progression. 2 to 4 days per week of resistance training can make a meaningful difference for many people, even if you do it at home. Fiber should also be part of that conversation. Fiber supports bowel regularity, gut bacteria, blood sugar balance, cholesterol metabolism, and fullness. Since GLP-1 related medications can slow down digestion and contribute to that constipation, fiber intake needs to be increased, but carefully. Some people do well with chia, flax, vegetables, berries, beans, psyllium husk, while others need to move more slowly due to bloating. Hydration is essential when using fiber. Without enough fluid, fiber can worsen constipation. This is where individual guidance can help. And electrolytes matter too. When people eat less, they may take less sodium, potassium, magnesium. If they're experiencing nausea, vomiting, diarrhea, heavy sweating, electrolytes need to become more noticeable and more required in those situations. Symptoms such as headaches, lightheadedness, muscle cramps, fatigue, and weakness may be related to dehydration and an electrolyte imbalance. This does not mean everyone needs high-dose electrolyte products, but it does mean intake should be considered. Simple changes like adequate fluids, mineral-rich foods, and appropriate electrolyte support can make all the difference in the world. Now let's talk about supplements. These can be helpful when they're used with a purpose. The first category to consider is that foundational nutrients. We always talk about it. Magnesium is one of the most important. This is because it uses and it supports muscle function. It supports your nervous system regulation, your sleep quality, and glucose metabolism. Many people do not get enough magnesium from food, and stress may increase the body's need for magnesium. Magnesium glycinate is often used for relaxation and sleep support, while other forms may affect digestion differently. The form does matter, and the dose should be appropriate to the person. Omega-3 fatty acids are another useful support for many people. They may help support inflammation balance, your triglyceride levels, cardiovascular health, and cell membrane function. Omega-3s are so important. For people with metabolic dysfunction, inflammation, and lipid health, these are often part of that whole bigger picture and that bigger conversation we need to have. For sources like salmon, sardines, and other fatty fish, this can help, but some people use fish oil and other omega-3 supplements when intake is low. For me, I don't like seafood, so for me, high-dose omega-3 fatty acids, but quality matters because oils can oxidize and vary in purity. This is another reason why guided supplementation selection is helpful. You want a high-quality product. It costs more, but what's your body worth? What's your life worth? So vitamin D is also worth discussing here because most people have very low levels. Vitamin D plays a role in your immune health, your muscle function, hormone signaling, and your metabolic health. Testing is important because guessing can lead to under-supplementing or over-supplementing. If someone is low, correcting vitamin D may be part of that broader support plan. It should often be considered along with magnesium and vitamin K2, depending on the person's needs and provider guidance. Again, this is where labs help guide those decisions. Berberine is an excellent and popular supplement in metabolic health conversation because it's been studied for effects on glucose and lipid metabolism. It is not a replacement for medications, and people taking diabetes drugs, they got to be careful when combining glucose-lowering agents, which may increase risk of low blood sugar. Some people tolerate berberine well, while others experience digestive upset. I myself have never had an issue with berberine, but other people I talked to they got stomach pain from it. But for the most part, people do well and do not have any issues. Some people tolerate well, while others will experience that digestive upset. So, everything works different for each person. It may be useful in selected cases, but it should be matched, again, to that person's situation. This is especially important for people already using GLP-1 or related medications. More is not always better. Another big one is digestive enzymes. These may be useful for certain people. If appetite is low and digestion is slow, meal size, food texture, fiber type, and timing may need adjustments here. Some people may benefit from digestive enzymes, ginger, probiotics, and gut support, but not everyone needs the same thing. Again, individualized. If someone has severe nausea, persistent vomiting, abdominal pain, or significant constipation, they need medical guidance rather than trying to solve it with supplements on their own. Supplements should support the plan, not hide warning signs. So Mindful Objective can help people think through what is reasonable and when to refer back to medical care. So sorry this was a long podcast. We're going to wrap things up. So, there's a lot that goes into Retatrutide, Reta. Again, you'll hear Reta a lot on the internet. It has a lot of promising results for even longevity. So something definitely to keep an eye on and watch when it actually fully comes to market. So as we wrap this up, I want to remind you that Retatrutide is one of the most talked about medications in metabolic health, and it is for that reason. The research so far is showing meaningful effects on weight loss, on blood sugar, on liver fat, and needs a lot of attention. It deserves attention. The New England Journal of Medicine Phase 2 obesity trial, the Lancet Type 2 diabetes trial, and the Nature's Medicine liver fat substudy all show why researchers are watching this medication closely. At the same time, it's still under the study and should not be treated as a casual weight loss shortcut. The science is exciting, but the conversation needs to stay reasonable. The biggest takeaway is that this medication can be a tool, but it's not the whole plan. Whether someone is using semaglutide, tirzepatide, considering future options of retatrutide, or trying to improve metabolism naturally, the foundations still matter. Protein matters, muscle matters, sleep matters, stress matters, blood sugar matters, gut health matters, lab testing matters. That's both conventional and functional labs. So again, reach out to mindfulobjective.com or go to mindfulobjective.com and look at the options that are out there. And if you want 20% off supplements, again, mindfulobjective.com, sign up for 20% off supplements. I guess I should say this, United States only. But before you go, I want to remind you again that this podcast is for educational purposes only and should not be taken as medical advice. Always speak with a qualified healthcare provider before making any changes or taking any medications like Retatrutide. Also speak with a provider before changing supplements, especially if you have diabetes, kidney disease, or liver disease, or any of those other ones out there. Always work with your medical provider. Also, if you have any questions, feel free to reach out to us. If you're interested in integrative health approach, working on your nutrition, running labs, focusing on stuff from a natural perspective, again, Mindful Objective. I'll catch you in the next episode. Stay well.